Good morning, everyone. We're going to go ahead and let our participants join the room, and then we'll get started here in about 1 minute. Takes a little while for Zoom to let everybody into the room. All right, I'm going to start us off with a few introductions and housekeeping. So good morning and welcome to the National Center for Healthcare Leadership's Coffee Chat. Today's discussion will focus on Wellbeing 2.0, moving beyond individual resilience and onto systems level integration. My name is Megan Hussein and I'm the Director of Communications and Membership with NCHL. Before we get started on today's discussion, I have a few housekeeping notes. First, if you have a question or comment for one of our panelists, feel free to put those into the Q&A section. While we're going to try to hold time for questions, should we not get to them, we will do our best to address those offline. Additionally, we're utilizing Zoom and have enabled the closed captioning option. Should you wish to enable your own closed captioning during this event, please click the closed captioning button at the bottom of your Zoom window. Finally, at the end of today's session, there will be a very short 3-question evaluation, and we would appreciate your feedback and input on future educational offerings and coffee chat discussions. Now, without further ado, I'm pleased to introduce today's moderator and chair of our Leadership Excellence Network's our Wellbeing Council, Dr. Catherine Meese. Dr. Meese is an assistant professor for the Department of Health Services Administration, director at the Center for Healthcare Management and Leadership, and the Director of Research with UAB Medicine Office of Wellness at the University of Alabama, Birmingham. Dr. Meese, thank you so much for being here today.
It's a pleasure to be here, and thank you for having me. I'm really looking forward to this conversation. It is quite quick, but I think we can cover some really important territory, and I'm so thrilled to have our distinguished panelists with us today. I will do a brief introduction of the topic for today, and then we'll give everybody an opportunity to introduce themselves when they kick off our Q&A session together. So, you saw the title of this panel and you might be thinking, okay, what exactly does this mean? So I want to spend a couple moments talking about where we have been in the wellness conversation in healthcare and where we're going. And there's a bit of a movement that many of you may be already making in your organizations, and some of you may be not doing that yet. But when we talk about well-being in the healthcare space, we're often talking about our clinicians, our frontline healthcare workers, and there are many different avenues to consider well-being. A lot of what we hear in this space is around the topic of individual factors that might contribute to well-being. So these might be things such as increasing individual resilience, mindfulness practices, maintaining your own personal health, or psychological or social health. And those are good and important things. Those are wonderful things. I think the pandemic has challenged all of us. We need to be doing everything that we can to hack our brain. So all of those good tricks, from exercise and rest to gratitude and social connection. But on the other hand, we also know that there are tremendous organizational factors that influence an individual's well-being in the workplace. And so particularly in healthcare, we have faced one of the greatest seasons of challenge that as an industry we've ever faced before. And so what we found through our research is that when we look at individual well-being within the healthcare context, we looked across the organization at people ranging from administrative and non-clinical workers to physicians, nurses, APPs, and clinical support staff. What we found is that most of the drivers of individual distress were work-related. They were things like heavy workload and long hours, feeling psychologically unsafe at work, perceived inequity in distribution of resources such as pay cuts and vaccines. And so really there's a huge organizational responsibility in contributing to or detracting from organizational wellness. And so simply put, while all of the things that we can do as individuals are things that we can do right now, we are not going to fix this problem of burnout, disengagement, and exodus from the healthcare workforce by putting some lavender oil on it. So today we're going to talk a little bit more about organizational approaches to pursue wellness for our very valued and treasured healthcare workers. So I want to start off with Dr. Safir. If you could introduce yourself briefly, your role and title, and tell us a little bit about how your organization is pursuing a culture of wellness. Oh, I think you're muted.
I've only been doing this for 2 years, so thanks for having me here today. I am the Chief Medical Director of Employee Health and Wellbeing at Johns Hopkins Medicine. Catherine, there's so many things that you said that I want to latch on to. Generally speaking, we have to recognize that well-being is a team sport. It is not an individual endeavor. And this became abundantly clear during the pandemic as we all showed a much greater respect for the role that social connectedness plays in our own well-being. So we've been following a culture of health and well-being framework for about 10 years now, because we know that when the culture is designed to support well-being, it's easier for everybody to embrace well practices, attitudes, and beliefs. So we have a very intentional model that's made with 6 building blocks, and I'll just briefly highlight those blocks. You're not going to be surprised by the first one. The first one is leadership support. Without good leadership support, it's really going to be difficult to create that culture. And we're not just talking about leaders in the C-suite, we're talking about leaders at all levels, which means that people on the front line of management, like your managers and supervisors, they need to be included when any training is provided on how to lead with well-being. You're going to be a little bit more surprised by the next one, because I don't hear often the inclusion of our second building block, which is peer support. We know that when someone tries quitting smoking, they're going to be more successful if they quit with somebody else. We also know the same is true that when we try to lose weight, when we do that with one or a group of people, it's easier. And the list goes on and on. And there are things we can do as employers to help foster peers working together. And it's not just for physical health, and it's not just that social health. There's a lot we can do for each other with our mental health. I'll tell you, Catherine, every time we get on a Zoom call together, I see your smile, it makes me smile instantly. People don't often think about smiling as a well-being strategy, but it really helps each other. The third category or building block is shared values. So these are the priorities of the organization. These values that not only are in the organization's bucket, but also are individual values. And well-being needs to be part of those shared values. And it can't just stop after the words are said. Organizations need to work well-being into their priorities and demonstrate them through a variety of ways. Yes, it is partly about providing resources, but it's also about including it in your business strategy. Why not hold your leaders accountable every year to a well-being metric? The fourth category is social climate. And there are 3 ingredients to a good social climate. The first is having a sense of community, making people feel like they belong. And yes, people want to feel like they belong to the organization, but it's even more important that they feel like they belong on their immediate team. And there are ways that an organization can help support that. The second ingredient in a good social climate is having a positive outlook. And that means focusing more on what's going right than what's going wrong. The third ingredient is shared values. I'm sorry, a shared vision, excuse me. So the shared vision is about people knowing that they're all going toward the same place. They have the same goals and they're working together to get there. So these 3 ingredients, this social climate, is akin to how do we change employee morale? The 5th building block I call culture connection points. And these are the levers that an employer can take to put in place to influence behaviors and attitudes. So these are the things like how we build our workplace environment. Are the stairs accessible is a very common example, but less common is, are we providing lactation support rooms for moms? It's not just about the convenience. It's a way to decrease the stress for that segment of our workforce. There's 7 other, I don't have time to go through all the other ones. And so the last building block is about norms. How do we create shared behaviors that are the norm, the way we do business? A common example in healthcare is that providers wash their hands before they go in to see a patient. And after they see the patient, they do the same. Well, we can intentionally create norms around other items, such as having work-life balance. We can create a norm about not sending emails past 5 o'clock. We can do that using our other 5 building blocks. And in fact, all of these other building blocks work together. It's a Venn diagram, in fact. So thank you, Catherine, for allowing me to share our model for how we approach organization health.
Excellent. So I love how you've touched on norms. And I think what the pandemic has shown us is that so many of the norms that we've accepted in healthcare are no longer working for us. So the way that we expect providers to ignore their own health, to prioritize the health of their patients, many other factors that just aren't working anymore. And so I love that you've pointed out the importance of challenging some of those long-held norms. Ms. Smith, I wanted to pivot to you, and you're representing Sodexo today, and Sodexo is doing some really interesting things around changing some of the norms that we routinely see in the hospital. So tell us a little bit about what you guys are doing.
Sure thing. Thanks for having me today. So I'm Amanda Smith, and I am the Vice President of Marketing for Sodexo for our healthcare segment. I'm really responsible for all of our food offerings, and challenging the norms really is the great way to frame up what we've been doing, I would say, since the pandemic has hit. We've really tried to challenge the norm and understanding of Sodexo being a food service vendor and really transitioning ourselves to be more of a healthcare partner. And we've done that really by not asking, what are the food needs for the healthcare professional, but really taking a step back and saying, what are those broader experiential needs for the healthcare professional? We do know that food and nutrition obviously has a very direct link to well-being, but we said we want to take a step back where and Dr. Safer, what you said about the cultural connections, are things convenient? Time has become a #1 barrier. We don't have the time even to make our way down to the cafeteria to get the food and nourishment we need to be able to do our job, provide that engagement, and drive those patient outcomes. So that's been an opportunity that we've been looking at as well. And then lastly, what are those nutritional needs of the healthcare professional? So I'll talk a little bit about the nutritional needs first, because it probably hits closest to home in our tradition. But what we've really found, and again, probably not surprising to all of you who are out there on a day-to-day basis, but the days of sit-down fork and knife meals are probably not what's needed anymore. It's those, where can we get those high protein grab-and-go snacks to really fit in the pocket, so that when you're out there, not that we want to reinforce that norm of not taking breaks, but how can we make sure, if that's going to be the case in the short term, that we're providing those nourishments. So we've got plans to bring out new offerings, new menu offerings, new planograms, if you will, to actually provide those nutritional foods out to the staff. From a time perspective, what we're doing is re-looking at how might we provide that nourishment in a different way, because we do know walking down to the cafeteria, standing in line is not the future state of providing nourishment to healthcare professionals. So this is everything from digitally enabled retail. How can you order, pay, get delivered the food up to where you are, to how do we bring the food to you, whether we've got these coffee carts that can come around at 3:15 and provide those afternoon breaks and that caffeine that might be needed, to actual lockers that sit on the floor where you can go and pick up your meal in a heated locker and it's ready for you waiting. So really trying to think outside the box on some of those things. The last piece is really that stress intensified. And so what we're trying to do there is actually look at what are those other needs in other areas that we could provide benefits and services to actually help take some of the burden of workload off of the traditional, in this case, nursing staff. But this becomes everything from how can we round and engage with the nurses with a very specific tool, so that we're understanding not only, what can we do from a predictive analytics perspective to already know this is going to be a pain point, so how can we drive it? But those real-time needs of, the patient in room 301 needs their water refilled and the nurse just doesn't have time to do that. Those are capabilities that Sodexo could potentially take on as well. all the way to kind of bigger picture items of concierge services. So this is an area where I think we've definitely underplayed before, but seeing that need, as you said, a lot of the stresses are within that work environment, but how can we offer concierge services that could perhaps alleviate some of that need on the outside of work stress drivers as well. And this is everything from helping you find babysitters to plumbers to even helping vacation planning. And so these are some of the solutions and services that we're looking to expand within Sodexo, really specifically designed to hit at that well-being and drive that well-being forward. So Dr. Meese, I'll hand it back to you.
Excellent. Thank you so much for that. I think you both hit on a really important point, and it's this idea of how do we provide short-term relief without reinforcing norms that we don't want to continue. And so I think that's an important thing for our organizations to consider, that there is a short-term component to addressing the immediate pain points of our employees, but then there's also building towards the norms that we want in the future. So for example, when we're thinking about work design, improving efficiency of processes and so that people can do more with the little resources that they have, the little human resources that we have, is something that's very helpful in the short term. But we want to make sure that the way that we approach it is not reinforcing this idea that people are machines that can be cranked up faster and faster. And so it should be a norm that you can take a break and go to the cafeteria and chat with a friend, because we're working with humans, we're not working with machines. And so I really like how you've both touched on that importance of norms, recognizing that where we are right now today that might require some short-term relief is not necessarily where we'll always be or where we hope to always be, but we certainly have a role in building that as organizations. How do we meet people where we're at, but build towards the future that we want? And with that, I'm excited to introduce our last panelist, Dr. Katie Kay. She's coming to us from Emeritus. And so many of the things that we're talking about here really come down to leadership. These are things that have to be reinforced, developed, and championed by leaders from the top to the bottom. And so, Dr. Kay, I'm wondering if you can talk to us a little bit about what are you doing to work on the current and future leaders of healthcare?
Sure, and thank you for having me. This has been great discussion so far, and I think so much of what I'm going to contribute really overlaps to what both of you have already said. I'm Katie Kay. I'm the Vice President of our Academics of Healthcare at Emeritus, and the one thing that I just want to lead in what I'm going to discuss is we've learned so much the past 2 years, and those organizations that really did well had two really very common themes, and that was that their employees felt valued and respected. So how we create that value and respect definitely comes down to leaders at every level, and I see really three major buckets for educational opportunities for leaders. The first one is authentic leadership. And there's so many components of that. Empathetic listening, really hearing what your staff is going through, making those minor changes on a day-to-day basis, effectively leading teams. I think for me in nursing school, so much was driven in the primary nursing model, which is not the model that we have in care delivery today, which is definitely more team-based, especially with the pandemic and rapidly switching to new staffing models that we weren't experiencing before. Nurses might not always feel comfortable leading teams. Teaching delegation as a skill is not the same as effectively creating that team environment. So I think education in that space is big and just falling under that authentic leadership bucket. The next one I would say is strategic planning. And this goes into what we were talking about earlier too, with having a short-term plan and a long-term plan. So the short-term plan of having snacks available that are high protein while we mitigate the staffing crisis and plan for the future, I think is awesome. Another short-term plan I would have loved to see as a nurse at the bedside was have grab and go meals that you could take home ready to go for your family. Anything you can do in the short term to let your colleagues know that they're valued and make their life a little bit easier, I think really speaks volumes to your healthcare employees. But also teaching that strategy for the long term. So we know we're in a situation right now where really the way we're delivering care in a healthcare space is not sustainable. We are losing nurses faster than we're producing them. And care in the inpatient world particularly is getting more complex. So what are the strategies we're going to put in place to retain those nurses that are transitioning completely out of the profession or to a different domain of the profession? I think it needs to be at the forefront of what we're educating our leaders on. And then the last bucket that I think is really important is how we're using all this technology. So implementing technology changes at rapid fire with the pandemic. We had to make a huge leap to how we're delivering care, and now a lot of that care is virtual. So how can we best leverage what technology is out there to make our workflow better and make the quality of our patient outcomes better? And the one thing that I loved about the conversation of the norms is, if you look at, and this is going to relate to technology, I promise, but if you look at the way we've done staffing traditionally with the 12-hour shifts and nurses having 4 days off a week, I hear the common theme that nurses want more days off a week, but if we're calling them every day that they're at home to come in on those days off, I don't see them getting that mental break or really stepping away from the 12 to 14-hour shift that they had. So we have the technology to have like opt in for text messages if you want to pick up, opt out if you don't. So we're not invading the nurses' days off and time off by asking them to fill staffing needs. The other thing you can do with those platforms too is allow for more flexibility in how we're scheduling and staffing. The traditional 7A to 7P, whether it's AM to PM, PM to AM, might not work for the healthcare colleagues of today. It might have worked in the 70s and 80s, but as care has become increasingly more complex, that I think is going to have to be something that we explore to really create a better work-life balance and to create that norm around work-life balance for our frontline staff. And then the other thing with technology too is how can we best leverage technology for our patients to access information to help with their homegoing instructions, things like that, that would really alleviate some of the things that we might not have to do face-to-face. Is there apps that we can use where they would be connected with someone to go over their medication management plan? Is that an opportunity to switch some of our healthcare colleagues that have been working at the bedside that want to explore a different space to connect them in some sort of virtual way as well? So all of that too, from a technology perspective, ties into the short-term and long-term of strategy. So from my perspective, it really just boils down to those things: authentic leadership and really teaching leaders to continue to develop in that space, be prepared to have short-term and long-term strategy development, which is a skill that we can all also continue to develop and learn, and then leveraging that technology.
Excellent. You know, Dr. K, I think you hit on something that is so important for us to consider if we think about the jobs, demands, resources model as a way to frame our thinking around well-being. The idea is that well-being occurs at the balance of having the resources to meet the demands that are placed on you. And so only having the resources is not enough to balance that equation. We have to also address the demands. And I think so many of the great suggestions you had push on that other side of the equation, which is not always what we first think about when we think of wellness. You know, how can we reduce the job demands that maybe are unnecessary or could be reallocated to other members of the care team, or don't really need to be done by the professionals who have always done them. So I think this next decade is going to be a tremendous challenge for us as we try to replace the people that have left the healthcare workforce altogether, knowing that it takes, 4 years to make a baby BSN and, 11 to 12 years to make a baby practicing MD. And so we have a lot of work to do to keep the people that we have, but also to reimagine work and who can do what. And so I think it's going to be a painful time, but also a great catalyst for us to reinvent how we deliver care. So thank you for highlighting some of those things. So I just wanted to close out maybe with one final question as we're trying to keep everybody on time here. For each of our panelists, if you had one thing that you could tell a future leader or a current leader, someone who's about to go into this space and take on the tremendous privilege and weight of leading healthcare professionals, what would you say to that person?
I would strongly encourage that person to have a framework to follow. I think all too often we look at this area as a huge challenge, and we just jump in with something that we think is needed and perhaps easy to achieve without looking at the big picture. If we can all understand that if we have a framework in place, we're going to be much more methodical towards addressing all the various needs that our organization and those people who make up that organization has. In the long run, we'll be much better off. And obviously, I've already played my cards. I know what my bias is as to what that framework looks like. I was actually taking notes as Amanda and Catherine were talking about how there are different strategies, which building block they fit into.
Excellent. And so just to reinforce for people who are listening, if they wanted to pursue that same framework, can you remind us which framework you're using and where one can find it?
Sure. It's the Culture of Health framework. You can either find it on richardsafir.com or you can look for a journal article in the Journal of Occupational and Environmental Medicine. I think it was like 3 years ago the framework was published. And you could also follow me on LinkedIn because that's what I post about.
Excellent. Thank you so much. Ms. Smith, what about you? What would you say to our future leaders?
Yeah, so I think, in the space that we play in, it's really about, let's take a step back and really let's have an insight-based approach to what we're going to do, and let's observe the actual needs of the end user and what we're trying to solve for, and what are their goals, which, might not be, I just need to get, a piece of pizza at 12 o'clock. But what are those bigger picture goals for the organization where they're working for, and how can we provide services to them? And it really does reframe the outcomes that'll come out of that. And I think you'll see some very different approaches from Sodexo going forward based on this reframing of how we're understanding the needs of the healthcare professional.
Awesome. And Dr. K, what about you?
I think I highlighted this previously, but it really, to me, comes down to leading with authenticity and being very transparent. I think just taking the time to understand what the actual challenges are and listen from a place of understanding instead of responding is so important, because once you identify what those challenges are, I think that's when we really can start focusing on those short-term and long-term solutions and really reestablishing new norms in healthcare.
Excellent. And I think just to build on that, the order of operations is important. So we've talked about organizational approaches to well-being, but certainly all of us have resources or things that we're doing to try to promote individual well-being. And so I think it's important that those opportunities to our employees are always communicated in the context of, we recognize that the work environment is contributing a lot to your distress, and here's what we're doing to fix that. But organizational change is slow. So while you're waiting, here are things that you can do right now to make sure that we're not putting the burden of responsibility for a broken system we've created on the individuals who are having to bear it. I think for my one thing I would say to future leaders is, I'm sure anyone who has been in the healthcare space for long has heard the phrase "no margin, no mission," which is usually referring to the importance of pursuing a strong financial performance, strong financial margin. And my request, my exhortation to future leaders would be that we really need to expand that concept of margin to consider the human margin. So right now we're having to cancel elective surgeries across the country, not because we're being required to shut down, but because we don't have the people. And so without the human margin, everything else grinds to a halt. So every discussion we have, every decision we make needs to consider that human margin. What will this do to our humans? What will it do to their well-being? What is the state of our humans? How are they? Not just, do we have enough warm bodies to fill the spaces that we have? So I think some organizations are doing this beautifully, but as an industry, we need to change the way that we think about margin to very much include the humans and their well-being. So I think we probably are right at the end. And so I really appreciate everybody coming to join us today. We are all, I think, all on this call happy to connect with you, to follow up, to have an ongoing conversation. And so I appreciate your time and listening to this important topic. And I will say that I think we are all trying to do our best to move this conversation forward in our own organizations and as an industry. But the challenges, the external challenges and internal challenges are real. And so I am hoping that we can all continue to push, continue to make progress, knowing that it will be a slow journey towards change, but that our industry will be better off for it. So have a wonderful week. Thank you for joining us today. And very big thank you to our panelists for spending your time with us. Thank you so much.
Thank you.
Thanks, everybody.
Thank you.